Welcome to this unit on policy, model legislation and governance of AI. By the end of this unit, you will be able to discuss considerations for policy, legislation and global governance of AI for health. Policy observatory and model legislation. As AI plays a more prominent role in health systems, governments are introducing national policies and laws to govern its use in health. To ensure laws and policies address ethical concerns associated with the use of AI, the OECD launched a policy observatory in 2020 to help countries facilitate and monitor responsible AI development. WHO is exploring collaboration with the OECD on a policy observatory to identify and analyse relevant policies and laws. WHO is also considering issuing model legislation as a reference for governments to develop their own laws. It would be intended as a guide to ensure appropriate protection, regulations, rules and safeguards to build the trust of the general public, providers and patients in the use of AI in healthcare systems, and for the management of data and information to improve the accuracy of AI without compromising privacy, confidentiality, or informed consent. Global governance of AI. AI is playing an ever-expanding role worldwide. It has contributed $2 trillion to global gross domestic product, and this could rise to more than $15 trillion by 2030. The importance of AI can also be measured by the positive or negative role it might play in achievement of the Sustainable Development Goals. There is a form of governance of AI through the growing range of ethical principles, regulatory frameworks, and national laws. However, adherence to international human rights obligations related to AI differ widely among countries, between the public and private sector, and between governments and companies. Company standards also influence the control of many AI technologies, including those used in healthcare, due to the large number of users on their platforms. International oversight may be required to ensure AI standards and laws converge on a core set of principles and requirements that meet ethical principles and human rights obligations. Otherwise, the short-term economic gains that could be made with AI could encourage some governments and companies to ignore ethical requirements and human rights obligations and engage in a race to the bottom. First, global governance requires a common position and commitment from governments and companies to ethical principles and human rights standards. Currently, there is no commonly agreed definition of AI. Secondly, global governance could strengthen the voice and role of low and middle-income countries. These countries tend to be less involved in developing AI technologies or in setting international principles. They also lag in use of AI, including in health, partly because of the enduring digital divide, and may not yet have the capacity to regulate use of AI. Thirdly, global governance could ensure that all governments can adapt to the changes that will be introduced as these technologies become more sophisticated and powerful. Independent scientific advice and evidence will be necessary as AI technologies evolve and are translated into policy guidance. For the use of AI for health, it is critical that global health agencies promote only those AI technologies that have been rigorously tested and validated as health interventions by an appropriate authority such as WHO and assessed for risks. Global governance of use of AI for health will consist partly of adapting governance structures, including the policies and practices of global health agencies, treatment guidelines issued by WHO, and global agreements to meet certain health objectives, such as eliminating HIV and AIDS by 2030. Furthermore, global standards should be set for all ethical concerns of AI for health, such as impacts on labour, data governance, privacy, ownership, and autonomous decision-making. Non-government organisations and community groups will also play critical roles in ensuring that human rights obligations and ethical principles are considered from the onset of decision-making, respected in practice, and that governments and companies introduce appropriate safeguards to prevent and respond to any risks and swiftly redress any negative consequences of the use of AI. Civil society and affected communities should participate in the design of AI technologies, and international organizations should work with non-governmental organizations and affected populations to develop a mainstream guidance for government and companies. Efforts have been made to improve global governance of AI. For example, the joint initiative of the governments of Canada and France to establish the Global Partnership on AI in June 2020, which now comprises 19 countries. In 2019, the United Nations Secretary-General's Roadmap for Digital Cooperation recommended creating a strategic and empowered multi-stakeholder, high-level body, building on the experience of the existing multi-stakeholder advisory group. Such a multi-stakeholder body would contribute to the wider governance and standard setting required for AI, and provide means for addressing many of the challenges related to the ethics and governance of the use of AI for health. You have now completed Unit 8 of Module 7, Elements of a Framework for Governance of AI for Health. Now try the end of module quiz to review what you have learned.